Hello there. This is going to be chapter 19 in your book, which deals with nutrition and heart disease. So we're going to take a look at just some key risk factors, things that put us at risk for that particular disease. So first of all, just understanding the definition of heart disease. It is definitely the one of a number of disorders that result when circulation of the blood to parts of the heart is inadequate. So a lot of folks sometimes call it coronary heart disease, coronary artery disease, or heart disease. So it's all interchangeable. So also heart disease is the leading cause of death worldwide. So number one cause of death, followed pretty closely by cancer being the second cause of death. So 1 in every 4 people today suffer from heart disease. That's such a huge number. And also some other important points is that women suffer from this disorder just as often as men do. And also in the United States, we see more African American and Hispanic Americans suffer from cardiovascular disease or heart disease. These numbers definitely are going down, mainly because we have better access to health care, and also people are making lifestyle changes. They are reducing those risk factors, taking control. So what's happening is a lot of times the arteries in the heart become built up and clogged with what we call plaque. But it doesn't just occur in the heart. So we can see heart disease or coronary artery disease occur in other vessels that are in our legs, for example, or even in our brain. So people suffer strokes as a result of a blockage in their brain, or also some of those limbs become blocked as well. So here you can see a picture of artery here, and you can see this yellow is the plaque buildup. So over time, the walls of the artery become narrower and narrower due to this waxy buildup of plaque. So therefore, it's allowing less blood flow to get through this portion of the vessel, which in turn can cause some outward signs and symptoms like maybe difficulty breathing, shortness of breath, chest pain, and things of that nature. Plaque buildup, just so we understand, does not happen overnight. It can happen over a lifetime of maybe practicing unhealthy behaviors. So just understand that this is something that is not an overnight. It's a chronic disease. It occurs over years. So here you can see in this picture the apex of the heart, and it's kind of shaded in a darker color, and that's because these vessels that are leading to this portion of the heart are blocked with plaque buildup, and therefore the oxygenated blood is not getting to these muscle cells. And when your muscle cells are starved of oxygen, necrosis or cell death occurs. So therefore, that's when people suffer heart attacks. So this is just an example of what that looks like. Here we take a look at the differences between cholesterol. So when we get our cholesterol, our serum cholesterol levels checked, we'd like to see all the numbers. What is your total cholesterol? What is your LDL? What is your HDL? What are your triglyceride numbers in regards to, cholesterol? And here you can see good and bad. And so we call LDL, which is low density lipoprotein, we call that bad cholesterol. I'd like to say lousy, L for lousy. That's the way we can remember it's bad. And you can see the reason it's bad because the major composition of LDL cholesterol is cholesterol itself and triglycerides. There's fewer proteins in it and fewer phospholipids in it. Whereas you can see the good cholesterol, the HDL, I always say healthy, H for healthy, so it's good. You can see the composition has a lot less triglycerides and cholesterol, but a lot more protein in the composition of it. So here you can see LDLs, kind of the reasons why they are bad is because it really transports more of this cholesterol in our bloodstream and contributes more to that plaque buildup on the walls of your arteries. So over time, it really doesn't do anything good for us. So high levels of this type of cholesterol in your bloodstream, this type of fat, definitely increases your risk of heart disease. On the other hand, the good cholesterol, the HDLs, they actually transport this cholesterol from your bloodstream down to your liver, and your liver will metabolize it and get rid of it as a waste product. So it reduces the amount of LDL cholesterol in the plaque. So, in turn, HDL's kind of, I always think of it as reduce the amount of fats we have floating in our bloodstream. So high levels of HDL cholesterol actually can reduce your risk of having heart disease. So the higher, the better. So the higher your HDLs are, the better. The lower your LDLs are, the better. So also I gave you a handout inside your content module for this particular chapter that shows you what those numbers should be. And I encourage you all to get your cholesterol checked. Find out what is your total. Total cholesterol should be below 200 milligrams per deciliter. LDLs should be below 100 milligrams per deciliter, and HDL should be at least above 40. Again, the higher these are, the better. 60 would be awesome. And then triglycerides should be less than 150 milligrams per deciliter. So get your cholesterol checked. Find out what those numbers are, because a lot of folks today are walking around with high cholesterol and they don't even know it. So who's at risk for heart disease? So these are some of the positive risk factors, things that are going to increase the likelihood of, say, suffering a heart attack or a stroke or congestive heart failure or things like that. Number one is having a family history. Obviously, if you have a gene, a strong gene in your family that puts you at risk for this disease, then definitely want to make sure that we're practicing, healthy behaviors. Having high blood pressure is definitely a big risk factor. Having high LDLs, low density lipoproteins, and low levels of HDLs, high density lipoproteins. Smoking, physical inactivity, age, normally we see it occur more often in those folks that are over 55. And then those people who are diagnosed with diabetes, especially type 2, tend to have an increased likelihood of suffering heart disease. Some additional risk factors that are contributing to this disease as well are obesity, especially the amount of visceral fat. Remember, visceral fat, fat that is stored underneath the muscle, or underneath the skin and on top of the muscle, underneath the muscle and immersed in between the internal organs, is more indicative of disease. So the more visceral fat we have on our body, the greater risk we have of having heart disease. And then obviously dietary pattern has a lot to do with it as well. So eating a lot of those really bad fats, trans fats, eating a lot of your refined and processed carbohydrates, and then more added sugars as well. And then lastly, insulin resistance over time and chronic inflammation over time is definitely a contributing risk factor too. So how do we prevent heart disease? Well, these are all some great dietary patterns that are going to reduce your risk of developing heart disease. So fruits and vegetables obviously are key, 5 to 9 servings a day. And then whole grains are very good as well, along with, fish and shellfish and beans, and the smart oils like olive oil, like we talked about back in that fat chapter. Nuts, seeds are great as well. Low-fat dairy products. Also, limiting your intake of, things that are high in added sugar, keeping fructose or high fructose corn syrup to a minimum, watching your sodium intake, keeping it below 2,400 milligrams a day, watching the bad fats, so limiting your saturated fats and trans fats in favor of maybe the poly and the monounsaturated fats, trying to reduce those processed meats, and also moderating the amount of alcohol. So these are all dietary ways that we can reduce our risk of developing heart disease. So here again, you can see those bad fats, the saturated fats, things that are very high in saturated fat. So we want to really eliminate these things, and also these processed meats that are listed down here, and more in favor of, say, the polyunsaturated fats. These would be better sources of fat, but also limiting these refined carbohydrates too. So how do people treat heart disease? The biggest thing that people take are what's called statins. And statins are drugs that are considered cholesterol lowering medications. So they mainly work on your LDL cholesterol and help to reduce the amount of LDLs we have floating in our bloodstream. So many people who have high LDL cholesterol or are dealing with heart disease, they will definitely be on a statin to help lower that. Also, dietary patterns are very key, so they have to adopt a healthy dietary pattern, incorporate more physical activities, and other lifestyle behaviors as well. So again, heart disease, leading killer today, but there are many things that we can do to prevent it. It is the #1 killer, but when you look at all the risk factors for it, we do have control over pretty much almost everything that puts us at risk for this disease.